healthcare and then what to say? Healthcare infrastructure and AI infrastructure and healthcare data. The define is going to be given by Parni.
So when we emphasizing our problem, nowadays when we apply for a checkup in a hospital, the data of the patient is scattered among many databases. So it's difficult to analyze what's the problem with the patient. So we gathered and discussed about how to solve this problem. So we made a project that collects the data of patients individually and kept in a separate. That's it.
So now the third phase of our TD activity, that is in terms of the various ideas going to be given by Santosh.
So in case of design, we have to make a design from the point of view of a problem statement. We are going to collect information from the problem statement and we are going to analyze what we are going to do as a prototype or a website or a app we are going to build. So based on this, we are going to make a website based on that. We have to collect the information by the AI algorithm. We are going to link with that and we are moving to next stage.
Now the next process of the TD activity in terms of prototype and evolve, iterate going to be given by.
We want to find the ideas on this, in which way we can solve the problems, and we want to find the program and code, and we want to implement it. If we have any error, we want to rectify the problem, and we want to give the web to the customers, and we want to take the reviews to the customers.
So myself, I'm Pranav Dayan. So we have created for prototype. We have created a website using VS Code. For backend, we have backend we have used Python and Flask, and for frontend we have used JSS, CSS, and HTML. So we have created an app, website which saves our details and data. We have also created a booking system for our healthcare AI. We have, if we book for test, we have created for test we have checked giving some several details, and we have booked the system, and we can get a notification in our own smartphone
From the data set.
So what are the errors we faced? So from the empathize we have faced some error. So our problem statement is critically based on data sets and database structures. So we saw many errors in that, and till the test we got the errors like in prototype coding, etc. So these are the errors we faced in this problem.
database.
We gathered meetings, Google Meets among the administrations and doctors and nurses to know what's the problem among the field. So we came to an idea that there is a time lag between the time lag on treating the patients because of the scattering of data. So we have separately kept the report on separate.
So from the case of prototype, if any error is there, we'll be going to the precise problem, and finally we are just defining it, and next moving to the prototype.
The people face many problems like booking an appointment, and they struggle to get previous records and data. So we plan to make it easy for the users. So we plan the. And we want to get the review from the users whether they have any problems. We want to rectify the problem, and again we want to protect it.
Then we have also created a feedback system for our app website. So people can use our app and they can leave some feedbacks. So we can also get motivated to create some more apps like this. And we have also created a booking system for appointments and appointments for doctors, for doctor checkup for basic human beings, and while booking, we used to get a notification on our phone smartphone.
Okay, the point of view in terms of the critical smart devices also available. So the domain healthcare, not only in terms of the AI, a number of miracle things are happening in the medical realm. So this AI will be giving up will be prioritized and segregating the ideas, either form of the data sets of the various origins, either of Asia, Africa, or maybe of Australia, Canada, North America, South America, or European countries. In terms what happened, this AI startup in terms of healthcare giving up substitutes and supplements for of the immediate medical emergency needs. So the student steps in initiative in terms of the AI startup, in terms of the medical issues can be focused on government, either of a government doctor appointment or maybe of a good doctor appointment, and also in terms of emergency case of scenarios or in terms of cases. They will be taking the actions appropriately at a right time to overcome what has happened. The soul is very, very important. That is the life. That is in terms of the more than of the value of the money. So this AI will be giving in terms of its values in the coming days, either a mobile app, web app, or in terms of smartwatches, or in terms of any of the smart wears, to giving up a best competitor in terms of the medical solutions to of the end customer. Very class, big class for the students for the idea.